So it depends again. I take many things into consideration. If
Okay.
it's a self-pay patient who the implant was recently placed, or it's just like something that's easier to just get, or tackle through a proximal corporotomy. Sorry, through a distal corporoplasty, I would just do the distal corporoplasty. If the implant has been there for many years, or the implant's not inflating now to the max because the guy has lost a little bit of fluid, or the implant's not working, then I would just take everything out, do that, on that side, I would do that extracapsular tunnel and then just get the implant in. I've had guys, for example, that they have both sides are creating an impending erosion. And for those guys, I would do that extracapsular tunnel bilaterally. And again, the good thing about it is you're going through a different space within the corporal tissue. That new space will collapse the previous space. There's no risk of that implant being in contact with that capsule, and it should buy them several years without them having any problems with impending erosions.
So if the pending erosion is, let's say, lateral in the lateral axial of the chaff, or would you try to go medially then to use that tissue as a barrier?
Yeah, so you can definitely do that. Again, the extracapsular tunnel does not work for everybody. I've had guys, for example, who have like very thin corporas, and there's literally no space around that capsule. And for those patients, I have to make a distal corporoplasty, especially for that scenario that you just described. If the impending erosion is lateral, sometimes the easiest thing to do is just do a distal corporoplasty. You incise that capsule both laterally and medial, direct that implant, behind that medial capsule, and just use that capsule as an extra layer to cover it.
And in those cases, would you do a ventral incision, or how you will expose the penis?
So usually for those distal corporoplasty, I do a lateral incision.
Just go straight lateral. Okay.
That's correct. Just straight lateral, right next to that impending erosion.
Okay. And that will cause any problems, near any problems in the skin in that area that will create infection or something? I don't know.
Everything is possible.
Okay.
But again,
probably it's easier. They're definitely easier to expose that area that you want to work on.
Of course. And for those cases, again, you treat it like if it was a full removal. You're going to wash it out very well.
Okay.
Make sure that doesn't get infected. There's one of the techniques that's used for this distal corporoplasty is actually use a stitch to fix it at the level of the glands. Perito uses that. And again, there's research articles describing all these techniques. And I think there's even videos in the VJPU and the Video Journal of Prosthetic Urology. And these are free access, open access. You don't need to subscribe or anything. You just go in there and everything's accessible to you guys.